MS can affect African American patients differently than Caucasians living with the disease. Dr. Mitzi Williams and Mary Hughes discuss MS in the African American community and the importance of further research to ensure that each patient receives the appropriate treatment specific to their disease.
My name is Dr. Mitzi Williams, and I am a neurologist and MS specialist in Atlanta, Georgia, and I'm so excited to be here with my mentor and colleague, Dr. Mary Hughes.
Hi, I'm Mary Hughes, and I practice in Greer, South Carolina. It's hard to believe we've known each other for almost 15 years.
That's
right. We met when you were a neurology resident, and I think we had a little bit of a mentor role, and then I was able to entice you into the field of MS. And
That's right.
It's going to be a great time to talk about all of the progression of what we know compared to what we used to know when we first started having these conversations.
Absolutely. It's come a very long way. And I'm so excited to be talking about a topic that's very near and dear to both of our hearts, speaking about MS and ethnic minority communities, especially the African American community.
Right. And you know, it's a very personal conversation for me. When I was coming through training, we were taught that African Americans didn't get MS. And you can imagine the shock when my sister was diagnosed with MS. And I spent a lot of time saying she can't have MS because we don't get MS. And when we think about what we know about who gets MS and what the course, all of this really wasn't known when I was starting out. And there's been so many questions along the way. And I really, you know, I laugh. I really want to take my hat off because the teacher has become the student, and as reviewing kind of the recent literature, it's just really compelling to see all the articles that you've been involved with and in answering a lot of these questions. So,
absolutely. And it was through your passion and interest in MS and opening the MS Center at the Medical College in Augusta that I was able to learn more about MS and do that rotation with you, and fortunately start my career following in your footsteps. So thank you for that.
Oh, thank you. So, you know, we think about MS. We always take a deep breath. I do. Always take it. And first, just talking about the challenges around getting diagnosed. It's somewhat of an irony. We know that many people don't get diagnosed right at the time they begin having symptoms, but unfortunately African Americans actually do get diagnosed quicker than their counterparts, mostly because they may have more aggressive presentations. So, you know, they end up in the ER or they have a symptom that brings them to attention faster.
Absolutely. And I think one of the most interesting things is that some of the more recent literature suggests that the risk is higher in African American women, which is very contrary to most of the knowledge that we've known during our research and time treating MS. And also the incidence may be higher in African American men and women. So there's a lot of attention being drawn to this population. And so the natural next question is, are we doing the appropriate things in terms of treatment? Are we doing the appropriate things in terms of research? And how do we get people involved in that conversation?
Right. And so, you know, even when we think about the diagnosis, I can recall, I don't feel like I'm that much older than you, but some days I do, that a lot of people didn't get diagnosed because they were told they had frequent strokes. I can remember one of my early patients that I met, and just ironically, I'd read about MS the night before, and I said, well, why can't she have MS? She kept having these strokes that couldn't get stopped. Right. And it turned out that that's what she went on to be diagnosed with. But even how people present, you know, in the 1990s, I was actually at Emory when they were doing the Optic Neuritis treatment trial. And that may be the first study that really showed that although 80 to 90% of people with MS will have difficulty with their vision at one time, African Americans are more likely to have more severely impaired vision and less likely to have the same degree of recovery. You couple that with African Americans are more likely to have involvement with their spinal cord, which leads to problems with walking. You know, those factors that really affect day-to-day quality of life, and especially since the average age of diagnosis is when people are the most active, when they're raising their families, when they're in their work environment. And so the onus is not only on getting the appropriate diagnosis, but you're right, transitioning to, you know, what's the most appropriate way to treat folks. When my sister was diagnosed, she was also a physician, and she knew that if someone had high blood pressure and they were African American, they started with a water pill.
Absolutely.
And so her question was, well, which drug is best for me. And you've done a lot of work in looking at that.
Absolutely. So one of the challenges is that with the new literature that suggests that risk is higher in this population as well as incidence being higher, that's not really reflected in what we see in the research, right? So if we look at MS research as a whole, there have maybe been 65,000 or more articles about MS in general, but there only have been maybe 100 or less about African Americans, ethnic minorities related to MS. Much of that suggests that the disease course is more severe, which is what we've discussed already. But if you look at the number or percentage of African American patients in those studies, it is very small. Right. So if you look at those studies as a whole, there'll be like maybe 1 or 2% enrollment of African Americans in those studies. So the honest answer to the question is we really don't know if the treatments are equally efficacious in this population. Certainly it's very difficult to make broad generalizations from very small numbers of people. So if out of 1,200 people who are involved in a study, you have maybe 20 or 25 or 30 African Americans, it's hard to make a generalization based on that. So that is an area that definitely needs to be addressed in terms of increasing the involvement in clinical research and being very proactive in making sure that everyone is equally represented in these clinical trials.
But I think one of the things that's exciting now compared to when we were first starting was that the number of options that we have. And so we always try to make the best decision we can for that individual patient in front of us. But what's even more important, if we know that African Americans may have a more challenging course, is that we need to watch even closer.
Absolutely.
And so first decision, first drug, important, but making sure we're all aware of and partnering with our patients to know when do we need to think about changing to another drug?
Absolutely.
When is this drug not doing everything that we want it to do? And when we should look at other options. And now that there's 12, 13, I almost lose count, number of different treatments that as the options have grown, our likelihood of being successful in decreasing the number of number of relapses, slowing the progression of disease over time, ensuring that people can have their highest quality of life becomes important.
Absolutely.
Now, you and I have talked about the concerns about African Americans having a consistent neurologist that is their primary care provider, and I think was it May of last year? So it's kind of sad to hear that like a year ago there's an article looking yet again at African Americans are less likely to have a neurologist that knows their name.
Absolutely.
And with MS, that becomes even more important. We're more likely to be seen in emergency rooms. Unfortunately, we're more likely to be admitted and have longer hospitalizations. Our whole goal is to prevent that. And making sure that you have an MS specialist, someone who is very engaged with the field, knows a lot about the treatment options. You always say a lot of people can bake a chicken, but we all know whose chicken we want.
Exactly.
And so finding that person whose chicken is that extra special that really is going to be in tune to your needs, I think becomes very important long term.
It's very key, and I think it all comes back to self-advocacy. So I talk to all of my patients and I tell them there's a part you play and there's a part the medicine plays. The medicine is not going to do everything for you. So it's so imperative that they are involved in the MS community, educating themselves. There's so many programs through CMSC, through other foundations and organizations where people can learn about different treatments that are available, different options, making sure that you're plugged in with that neurologist, getting appropriate monitoring, understanding the medications you take, why you're taking them, and what needs to be monitored. Just remembering that each person has an important role to play in their care. Medicine is no longer paternalistic like it used to be. So we don't just tell people what to take and send them home and eat an apple a day and keep the doctor away. Certainly there's a very active role that they play, and in the field of MS in particular, it really is about partnership. And so it's really a partnership between your neurologist and the person, and you all come up with the best treatment plan for each person.
And I think one of the things people struggle with is how do they know if they may not be getting the most the best care they could be. And I've had patients say, well, I don't even know what a relapse is.
Absolutely.
And so understanding the terminology, understanding what is a relapse, what may be a pseudo-relapse, maybe an event that's triggered by an infection. If you're having trouble walking and you've never been referred to physical therapy,
Right.
if you had to buy your own cane and no one actually took that as part of a conversation to say, should we look at your treatment options?
Absolutely.
If you've not had an MRI.
Absolutely.
all right? If, the exciting thing about having more treatment options is balanced by the fact that, yes, as we get more aggressive with our treatments, we do need to monitor labs. There are things that need to be done to ensure your own safety. And if those things aren't being done, then it may be a time to say, is this the best doctor for me?
Absolutely.
And I think part of that is, you mentioned reaching out to a lot of the groups, whether that's going online and looking at the National MS Society, who's had a very discreet outreach to African Americans, the MSAA, the MS Foundation, the Consortium MS Center. So there are a lot of resources out there. Now, you and I both have done a lot of patient education programs.
Absolutely.
And there's a challenge in the patient education programs. Not that people don't come, but we are less likely to see African Americans at those programs.
Absolutely.
And yes, we're glad that there are targeted outreach, but I think it needs to be part of your how do I care for myself to show up at these programs that are talking about updates and
Absolutely.
To really make sure that you're doing everything you can. And yes, it's confusing, but we have a history of using our community. Bring somebody with you.
Absolutely, and that's exactly what I was going to say, is that we who treat MS recognize that MS is a family affair. It is not just about that person, but the disease reaches to family members, friends, people who are part of that community. And so just like it affects those people, it's also important to bring those people in as part of the solution. So in terms of, I always tell someone to bring someone to their doctor's visit with them. I call the family members the truth tellers. So they tell us everything they don't want us to know. But it's important to engage the support community and recognize that the team, just like it takes a village to raise a child, I have two small kids, it also takes a village to sometimes take care of MS. So you've got your family members who are partners, care partners. You have your neurologist. You may have other team members such as physical therapists, occupational therapists, other physicians that may be consulted. So recognizing who is a part of your team and making sure that you engage those members of your team to support you and also make sure that your MS is being addressed as appropriately as possible.
And so we know African Americans have a very complex relationship with healthcare.
Absolutely.
There is data. Well, we know we're more likely to receive care through chiropractors or urgent care centers. Much more likely to be wanting to try that serum down at the barbershop.
Absolutely.
And concerns about, whether or not we want to participate in research.
Absolutely.
And you raised the issue of 1,200 people studied to see whether this drug is effective for people with MS. 20, 30 people who are African American. So can we really extrapolate that? So there really is a call for participation in research. And how do you address that with your patients?
I think the most important thing is to recognize that there is a way that everybody can be involved. So clinical trials are not for everybody. Some people don't want to be involved or can't be involved for different reasons, depending on where their MS has progressed or what previous therapies they've been on. But there is a way for everyone to participate, whether it's a survey, whether it's registering in a large registry to learn more information about people's quality of life. But also it is important for some people to be involved in those clinical trials. But just know that it's important to be your own advocate and to seek out that information and to get involved where you can get involved. And all of that adds to the body of knowledge about MS, and all of it leads to better treatment of African Americans with MS. There was a recent study that I was participating in with a survey that questioned people's involvement in research, and there was a lot of there were a lot of issues in terms of access to information about studies. So in some ways, some some of the previous hesitancy to be involved in research is still there, but there's also a lack of knowledge about where the studies are taking place. How do I get involved? And so making sure that we as providers increase the outreach to make it known where those studies are and where people can get access or be involved is also important. So it's a call for us as well as a call for patients.
And I think that pushes for or strengthens the need to engage in specialty care. I mean, investigating where is your nearest MS center.
Absolutely.
And yes, it may be a distance, and yes, there may be a waiting list, but the benefits of getting the cutting edge level of care and access. So, Mitzi, it's been a 15-year conversation between the two of us,
Absolutely.
and it's just amazing to see how far it's come.
Absolutely.
And I'm incredibly hopeful about what the future holds for people living with MS.
Absolutely, myself as well.